Hi, you guys. Welcome back for our daily practice questions. It is day 20, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 72-year-old male presents to the clinic with fever, cough, and shortness of breath for the past 3 days. His vital signs are as follows. Blood pressure is 100/60, heart rate is 105 beats per minute, respiratory rate is 24 breaths per minute, and the temp is 102 degrees. His confusion is noted by his family. Based on this information, what is his CURB 65 score? Is it A, 1? Is it B, 2? Is it C, 3? Or is it D, 4? Take a moment and tell me what you got in the comments, you guys. All right, y'all. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure we're answering what is even being asked of you, right? So, here the stem of the question states based on this information, what is his CURB 65 score? All right, and I need y'all to remember what CURB 65 is. We utilize CURB 65 to gauge the severity and how to manage pneumonia patients, right? CURB being confusion, urea, your BUN levels is for the U, R is for your respiratory rate, B is for the blood pressure, and 65 is age, right? So let's walk through it. C, we get 1 point because it states that he is confused, right? It says his confusion is noted by his family, so that's 1 point. We don't have any BUN results, so we're not going to score that U for urea, right? Our respiratory rate is greater than 30 is when you'll get a point. So theirs is 24 on this one. So we don't need a point for that, right? Blood pressure is when the systolic blood pressure is less than 90 or the diastolic is 60 or below, right? So it is 60 here. So you'll get a point for the blood pressure one. And then there's 72. He's 72 years old, right? So 65, he's 65 and older. So you get a point there. So the best answer here is C, 3. He would get 3 points because you get a point for each one of these that are positive for the C, the U, the R, the B, and the 65 of CURB 65, okay? Question number 2. A 65-year-old female presents with fever, chills, and productive cough. Her CURB 65 score is calculated to be 2. According to the CURB 65 scoring system, what is the recommended treatment for her? Is it A, home care with oral antibiotics? B, observation in the office? C, admission to the hospital for inpatient care? Or D, ICU admission for intensive monitoring and treatment? Take a moment and tell me what you got. Tell me what you got. Tell me what you got. All right, so stem of the question here states, according to the CURB 65 scoring system, what is the recommended treatment for her? All right, so we have a 65-year-old female, came in, she has fever, chills, productive cough, but her CURB 65 score is 2. So the best answer is going to be C. Remember, with a CURB 65 score, if they have a score of 2 or greater, they need to be admitted to the hospital. If it exceeds to the intensity of treatment in the hospital increases, meaning like if it's 3, then you want to have them in the ICU. You know what I mean? So it just increases. So 2 or greater, you need to admit, and anything greater than 2, it just intensifies on the level of care. I guess that's the better way for me to say that. All right. So C is your best answer. Admission to the hospital for inpatient care. Lastly, question number 3. A 58-year-old male with no significant medical history presents with symptoms of fever, cough, and dyspnea for the past 5 days. His vital signs are temperature 101 degrees, heart rate is 98 beats per minute, respiratory rate is 22 breaths per minute, and blood pressure is 130 over 85. He is oriented and alert. His CURB 65 score is 1. Based on this score, what is the most appropriate next step in his management? Is it A, admit the patient for inpatient care? Is it B, initiate IV antibiotics and admit to the ICU? Is it C, prescribe oral antibiotics and follow up as an outpatient? Or is it D, immediate referral to an infectious disease specialist? Take a moment and double check. All right, so stem of the question here. Based on this score, what is the most appropriate next step in his management? So what is his score? His score for the CURB 65 is 1. So the best answer here is to C, prescribe oral antibiotics and follow up as an outpatient. Remember, if they are 2 or greater, if their score for the CURB 65 is 2 or greater, meaning they have 2 points or more, then you begin to admit them into the hospital for inpatient care. If it's greater than 2, then they need to go to a higher level of care. So CURB 65 of 1, you still will manage outpatient, okay? Because we have not reached 2 points yet, okay? All right, you guys, I wanted to work through this because I know when we do our review and we talk through this and I'm working one-on-one with you guys and we walk through our CURB 65, y'all can recall it, but I find that y'all don't know completely the purpose and how to utilize CURB 65. So I hope that this helped to kind of tie that together. So as always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. And y'all know, as I always tell y'all, thank y'all, thank y'all, thank y'all. I appreciate all the shares and subscribes. And if you are looking to utilize anything that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. Everything that I offer is listed in the bio of this channel, including my website. But if you are looking to book any of my one-on-one sessions, in school students who prefer tutoring or coaching, or any of my custom packages or plans, I always say either call, text, or email because I prefer to speak with you to gauge what you truly need to make sure you're booking the appropriate session type, okay? But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.